BBC Radio Oxford, 9 minutes past 7. I was enjoying that. The Weekend and Blinding Lights. Now, let me tell you, this is a great story. Imagine this, you're a 17-year-old promising footballer, hoping to make it professionally when an injury puts a halt to your career. I've heard so many stories like this over the years, but this one has a difference. Nick Birch's life has been changed thanks to pioneering treatment right here in Oxford. We have one of the only arthritis clinics in the country that specialises in working with younger people. Now, the first for Oxfordshire. Our reporter James Kitchen has been to the Nuffield Orthopaedic Centre to meet Nick Birch.
Before I was treated, every day was a struggle. The small, meaningless tasks of tying up your shoelaces were difficult.
17-year-old Nick Birch suffered a serious footballing injury when his leg became dislocated from his pelvis. Nick was referred to Professor Sean Glyn-Jones, who heads up the Young Adult Hip Service, based at the Nuffield Orthopaedic Centre in Oxford.
He said that one day you'll wake up and you'll decide that a hip replacement is the only route that you have. You're going to be in too much pain. So that day did come. I woke up one day and big decision.
And what was that like talking to your friends and family? Were they quite surprised that a young guy in his 20s, a footballer, was suddenly having a hip replacement?
Yeah, hugely. I think, especially my friends, a lot of people you associate hip replacements for elderly, 17 above.
At the Orthopaedic Centre, Nick, who's now 25, told me that last year's operation has given him a sense of normality.
I had to used to have to put my left leg around the back of my right leg to tie my shoelaces because I couldn't bend properly. So post-operation, it feels weird to go back to normality.
And do you still have to be careful now? Are there things that you're not able to do that you would like to do? How do you live your life now?
Professor Glyn-Jones tells me to go and live my life normally, go and do what I want to do. I think there's always an element of doubt when you go in to do these things. You know, I'd love to go back and play football again. I think being sensible, I'm never going to be a professional footballer, so you know, sometimes you've got to put things into perspective, and the risk in Professor Glyn-Jones's eyes is minimal, but in my eyes, I don't want to go through that again, so I won't be doing it again.
Since his treatment, Nick has been fundraising to raise awareness of arthritis in young people.
I was actually lying in the hospital bed and Professor Glyn-Jones asked me, you know, for something you can achieve in a year, what would it be? And at first my answer was just get out of this bed. But then he said, no, set yourself a hard task. So the task was I wanted to climb a mountain, and then since then I've run a 5K. I feel though that here they've always been allowed for me to set my goals further afield, and that's why I wanted to do fundraising, to just show that, you know, this can happen.
James Kitchen reporting there. Natalie, you've been looking into more of this, haven't you? Sounds really interesting.
Yeah, I have. I'm probably guilty of presuming that it's only older people who are affected with arthritis, but it's really not. There are 15,000 younger people living with the condition in the UK. And I've been chatting to Oxford University Professor Sean Glyn-Jones. I started by asking him why the specialist clinic was started.
We did a lot of work about 10 years ago looking at how arthritis develops in the hip. Initially, years ago actually, we didn't know what caused most hip arthritis, but we now discover through research done in Oxford but also done in other parts of the world that the shape of the hip determines quite significantly whether you develop arthritis or not. And the milder deformities of the hip that people can develop as they grow can have a significant influence on whether you need a hip replacement or not. And in some people, those deformities are significant and give you a high risk of arthritis earlier on in life, in your 20s and 30s. In others, those deformities are mild and they can have a risk in your 40s, 50s and 60s. But, you know, as people become more active and people are advised to do more exercise as part of becoming healthier, particularly in later life, then we start seeing increasing problems with arthritis and joint damage and sports injuries as a result.
And what kind of symptoms are there? I imagine if you're younger and you're getting certain symptoms, arthritis isn't something that's going to pop into your brain, is it? Like, what should people be looking out for if they are younger?
No, that's right. And it's a gradual process. With this condition, we tend to see an initial soft tissue damage in the hip joint, particularly in sporty people. And we see what we call labral tears. That's torn pieces of cartilage in the hip. There's a structure called the labrum that goes around the hip socket, and that initially gets damaged. And people would typically present with very intermittent pains, sometimes catching, locking symptoms, usually when they're playing sport initially, but then becoming more frequent during routine daily activities, particularly sitting and squatting. And then over time, more achy pain develops, and that's an indicator that the hip is actually becoming arthritic. And of course, arthritis is where the surface layer of cartilage over the bone starts to wear away. And, that can develop at varying rates. So in some people, we see it develop over a period of 5-10 years. In others, it takes decades.
And if someone is having these symptoms, is it important that they see their doctor? If they're diagnosed early, can anything be done?
Absolutely, they should seek advice early on. The majority of people we can treat with movement, changing the way they do sports, changing the way they exercise. But some people, because of the shape of their hip and because they're in a higher risk group, we would consider for surgery. So the technologies that we developed over the past 10 years have been things like keyhole surgery, where we would reshape the joint and try to repair any early damage in there. Now, what is crucial about that technology is that it's important to see people early on in the pathway of the disease, rather than later on when arthritis has already developed. So to some extent, there's a preventative element in that respect. And we've recently conducted a large national trial looking at how this surgery works, and it's been shown to work in majority of patients.
This is like pioneering, isn't it, for this type of
illness? So obviously, because we've got a research department linked to us, we're developing even newer technologies to look at how we further improve the repair of tissues within the joint. And one thing we're looking at for patients with some early arthritis is the use of what we call bone marrow concentrate. So that's concentrated bone marrow, which contains high levels of stem cells and growth factors, which we use in conjunction with surgery to try and increase the likelihood of repair. And, that's a technology that has been around many years, but we are now repurposing it for keyhole surgery. And so we're currently conducting, I think it's the only trial in the UK, probably the only trial in the world at the moment, looking at this.
And how far in that trial are you? Have you got any results yet?
We're at the end of what we call a pilot phase, so that's looking at how it works in patients in the early part of the treatment. We're looking at how many patients we would need to go to a bigger, more substantial trial. And so at the moment, we don't have any firm results. We will probably take another 5 years or so to get those answers.